Okay, good morning everyone and welcome to today's webinar. We're delighted to have you join us for a session on curl extensions, weaving a unique property reference number into address histories in the Scottish Community Health Index. This session will be recorded and we'll also have time for questions and answers at the end, so please feel free to drop your questions in the chat as we go along. Before we hear from our main speaker, Dave Clark, I'm pleased to first hand over to Carole Morris, Head of Service at Public Health Scotland. Carole will introduce Dave and provide some more background on the significance of this work. Carole, over to you.
Thanks, Ellie. Yeah, so I just wanted to, rather than dive straight into Dave's presentation, just wanted to kind of do a little bit of an introduction. So Dave is one of the principal information analysts in my IDRIS team, which is my team that supports the Scottish National Safe Haven and sort of research support service. And he's also well, we call him the font of all knowledge, and he's got a nude square of his eyes at that, because he's been around the data linkage world for a number of years, and certainly when I kind of moved into this field was absolutely critical in kind of helping me to understand, and has very much driven forward a number of technical developments in this area, in the data linkage area, and one of them is the unique property reference number and probability matching that to essentially our kind of community health index number spine, which is our NHS Scotland unique identifier, so that we could start to do some household level analysis. And he's been doing this work very closely with our Scottish Administrative Data Research team. So the unique property reference number has been around for a number of years. But what we've not really done until during COVID, I think, is probably when it kind of kicked off big time, is actually kind of link that to individuals to allow us to do that person versus household level analysis. So Dave was fortunate enough to go to the International Population Data Linkage Network conference last year in Canada. And the presentation that he's going to run through today is the presentation he did at that conference there. So we'll give you a lot of the background and the work and how it shaped up, and some of the, we can probably talk about afterwards as well, some of the direction of travel going forward too. So I'll now hand over to Dave, who can talk through all the technical details that I understand at a peripheral level, and he knows all the details and is my go-to person for this. So thanks, Dave, for coming along to present today.
Okay, thank you. I've attempted to share my slides. Hopefully, have they started to show up yet?
They have, yes.
Great. Okay, thanks, Carole, for that introduction. It saves me having to introduce myself. So as Carole says, presented this at Chicago at the International Population Data Linkage Network last September. And the title of the presentation is a bit of a mouthful, quite a lot to unpack there. So I'll attempt to do that over the next few slides. Now, I've tried to move on. There we go. Now, I'm not sure if this will work. Is this animation working? It didn't when I presented it in Chicago. That's great. So that building you saw there at the start was Gyle Square, which is the headquarters of Public Health Scotland. So this was an attempt to show the journey that I made from Gyle Square over to the conference venue in Chicago. So this is down by the shores of Lake Michigan into the Millennium Park area. Then from there, we can zoom in on the actual conference venue that presented it. This was just a frivolous way of trying to demonstrate the power of being able to reliably and precisely identify exact addresses. So that was pretty, nothing much to do with the rest of the talk, but there we go. So just to unpack curl then, and that big title. So curl stands for CAI-UPRN Residential Linkage, which is an acronym of acronyms, and we do like our acronyms in the health service in Scotland. So it stands for CAI-UPRN Residential Linkage, and that's essentially about doing people to places linkage. So adding a property index number to our population spine. And the CHI number stands for Community Health Index. As I said, that's primarily what we use it for in Idris, is as an indexing spine, a population spine, to allow us to do data linkage for research studies in Scotland. The UPRN, as Carole's mentioned, the unique property reference number, it comes from Ordnance Survey. Every address in the United Kingdom should have a UPRN. And then the Carole extensions just refers to the development work we've been doing since when we first created the Carole product in 2020. It's the development's all about adding in UPRNs to the historic CHI addresses. So when we first did the work in 2020, it was just a snapshot of people who were living or had died since the start of the COVID period. But we've got all this address history on CHI, and which we can semi-reliably go back about 25 years to look at the address information there. And we also wanted to build on the initial matching by looking at alternative linkage processes. So we've looked at a couple more linkage algorithms to try and improve the matching since then. So a bit more about CHI. Basically, it's a general practice patient administration system. Everybody in Scotland who has been registered with a general practice since about the late 1980s. It goes back further than that in some areas in Scotland from the mid-1970s, but everybody from the late 1980s who's been to a doctor should have a CHI number, as has anybody who's been born since about the year 2000 or so, when the Scottish birth record came in. Within minutes of birth, a newborn baby gets allocated a CHI number. It's now embedded across the centrally held Public Health Scotland data sets, so it allows us to easily link these different health data sets together. We can also link beyond health by making use of our trusted third party that we use at Idris for research projects. That's at National Records of Scotland. They've got an indexing population spine, and they've got the CHI number matched to that as well. So that allows us to link beyond health. And crucially for this project, we've collated, as I said, the CHI address history tables. We can go back to around about the year 2000. But those addresses up until now have been very underused. The addresses are input manually into the system, so it's free text fields. There's no real consistency in the way that they've been entered. There's no look up to unique property reference number. For example, when you go on a website and you enter your postcode into this address field and you get a drop-down list to pick your address from. Nothing like that behind the CHI database. So it just means that there's inconsistent recording practices of the addresses, prone to transcription errors and so forth. And we can't easily identify people who live at the same address. This is just one made-up example of an address that could be represented in a multitude of different ways on the CHI database. So you've got things like there might be a property name as well as the standard address numbering system. There may be abbreviations, there may be some sort of concatenation in a single field, or there may be omissions of some part of the address. There may be typos and spelling mistakes. So the UPRN, I think most of you probably know about the UPRN. They're allocated by local authorities, are responsible for allocating UPRNs to new buildings, and it's Ordnance Survey that collate them at the UK level. In Scotland, we've also got Improvement Services who collate in the One Scotland Gazetteer. So that's just really a subset of the Ordnance Survey specific to Scotland. So having UPRN on different data sources means we can easily link at a property level these different databases. But if there's no UPRN, then if there is address information, we can use that to match that against the Ordnance Survey address base in order to seed that dataset with the UPRN. which is what we've done for Carole. Now, this slide's slightly jumping ahead, but this gives an example of the possibilities we can do for linkage when we've got this Carole address history file. So focusing on the left-hand side of the diagram, the green ellipse, we've got stuff that we've been doing for decades, basically linking health data together using the KI number, for example, prescribing information linked in with hospital inpatients. That's easy to do with the KI number. And we could also link cross-sectionally to anything non-health that have been matched against the population indexing spine at our trusted third-party NRS. So they've already matched the census, Scotland census data, and also Scottish Government education data sets. So those data sets can easily be linked across via the spine and the KI number on the spine to anything in that top ellipse for health data. But what's new is this Carole address history file. So as well as the KI number, we've also got the UPRN number associated with each address that we found a UPRN for, and a start and an end date where we believe that the person's been living at that address. And using that UPRN information, then we can link across at a property level to anything on that right-hand side. For example, energy efficiency certificates or property valuations, council tax bands, anything sort of environmental property level data that's got a UPRN attached. So you begin to get an idea of what might be feasible, what might be possible, opening up research possibilities using this Carole address history file. But how did we actually do the seeding? Well, we used, I already mentioned Improvement Services, who have the One Scotland Gazetteer. We used them, the data hub from them. So Improvement Services, their main mission is to help local authorities and other public sector organisations to help improve the quality of the information that they hold on behalf of their resident population. So they've got a suite of matching tools and cleaning tools, and one such as the UPRN seeding programme, which we used, and we're free to use it as a public sector organisation. It's a nice tool to use. It's easy to transfer your address file, which has been pre-formatted, then upload it, and then just allow the programme to go ahead and do the matching. It's reasonably quick. We sort of batched up the addresses in size of about 150,000 records at a time, and for one of those batches it would take about 20 minutes to return the results. So basically it returns the matched address and the UPRN and a category, so it sort of categorises the quality of the matches as being either excellent, good, fair. There may be multiple matches where it can't determine what is the correct UPRN. And there's also a clerical review interface. You can go in and you can break links or change to a different type of link. So there's a mapping interface in there as well, so you can pinpoint the actual addresses on a map, which is all very helpful. Unfortunately, we've processed a rather huge amount of data, I think about 10 million records in total through Data Hub, so there's no way that we could make use of that feature, and we've just accepted the base matches that have been returned. So the results when we did this in 2020, so as I said, it was everybody who we believed to be on KI at that time. So everybody believed to be living in Scotland, and plus those who had died since January 2020. So there was about 3.3 million unique address strings, and that pertained to about 5.8 million people. And we found 89.3% of those with a UPRN. So we're really pleased with those results. I wasn't quite sure what to expect, but I think everybody was generally quite happy with that match rate at that time. And it was used quite a bit within PHS, so the resulting Carole file, also a lot of COVID activities, such as I think it was used in the rollout of the vaccine programme, the contact tracing that was used in a few epidemiological things. You might have heard about I'm sure you'll have heard about the discharges from hospitals into care homes without adequate testing. So there was a big inquiry into that, and the Carole file helped a little bit with that answering some of those questions about care homes as well. We did a second snapshot about a year later, and again, similar results. But the problem is these are just snapshots. The vision was always to go back and take the historic CHI address, create this longitudinal resource so that you can, for research purposes, you can identify a cohort at any point in time and find out who they're living with, people are living with, and so forth. So when we did that, you can see there was 10.7 million unique address strings, 27.4 million. I would call these episodes of change of address on CHI. Overall match rate of 78.8%, which I'm not going to deny sounds a bit disappointing on first glance. And there's a good reason for some of these. A lot of these addresses really are historic. Say we could go back to 2000 or just before 2000, but some of these addresses are really, really old and debatable quality. So picking up the snapshots at the start of the time period, 2000, it was about 79.4%, and then it does increase as you go, as you pick up a snapshot at a later point in time, such as 2023, it was 87.6%. So the work that we've been doing since then in 2023 up till, in fact, the work's still ongoing, I would say, is quality assurance, just try to understand the quality of these matches, and also looking at different algorithms. So I'll talk about assign and flap to help try and improve these match rates. First of all, this is just a graphical representation of the results on the previous slide. So the blue bars are sort of 5-year intervals. That's the Scottish population according to CHI. It increases over time. That's the match rate which we saw there, just under 80% to just under 90%. And then the grey line is the proportion of those which the data hub had categorised as being excellent matches, which is the bulk of them, which is good to see. But we don't want to just take that face value. We've did quite an extensive quality assurance exercise. We sampled 5,000 non-exact matching pairs, so we've assumed that the exact matches are good. We stratified those non-exact matching pairs by the data hub match category, by the 8-fold urban-rural category, Scottish index of multiple deprivation decile, and a care home indicator. The care home information came from the Care Inspectorate in Scotland. They had a lookup of current addresses as at 2020, and with the UPRNs attached to these. So we sampled about 10 for each of these combination stratas, and the overall precision came to about 98.7% across all the distinct address strings, and that is higher when you look at all the different episodes. Accounts for 99.2. Obviously, where you've got an address string that has many multiple entries on CHI, you can assume that they are more accurate, more specifically written, and therefore higher quality and easier to match. So 99.2%. So for research purposes, I think that's probably more than adequate. When we break it down by the different match categories, the excellent, more near enough perfect. The good category, a little bit less, 99.5%, still very, very high. Then the fair category was, you're starting to get a few more false positives, about 13% false positives in that category. It's quite a small category in the scheme of things. I can't remember the exact proportion. It's probably between 5 and 10% of the address strings landed in that category. But we've retained that category within the product. It's interesting to look at it by the different types of area according to the urban-rural categories. The largest one is the I can't remember what they call it, but it's basically the city, the sort of your big urban cities. That's the largest one. What you tend to find there is you've got lots of obviously apartments, flats, and things. These are notoriously hard addresses to match because you've got lots of different doors behind the main front door, and also different levels, and there's different practices in different areas about how they define these addresses. The accessible small towns, on the other hand, you tend to have less of these flatted properties and more sort of housing estates, single front doors, quite well structured addresses, much easier to match. So that was the one that turned out with the highest precision, 99.7%. And then the one with the poorest precision was the very remote rural areas. And you can imagine lots of sort of country estates, farm estates. There's lots of different buildings within those estates, and sometimes it's quite hard to distinguish between the different buildings on these estates. And also in the very remote rural areas, a lot of these are up in the northwest Highlands and Islands of Scotland. So lots of Gaelic place names there as well, which is a bit more challenging as well. And then the care homes were, again, we're quite pleased with the results of that 99%. We did quite a bit of work on care homes in 2020 to try and, one, improve the match rate, because we're only getting about 60% match rate for the care homes. So we did a lot of manual work trying to trawl through the database and try to identify more, and that obviously helped with the quality of the matches as well. So on to the supplementary matching we've done. The first one here is called FLAP, Framework for Linking something addresses to a unique property reference number. That was a data scientist called Huai Zhang from Edinburgh University. He'd previously worked with a subset of the KI data in NHS Tayside. So he'd got very good results using his FLAP product. And well, we invited him in on a honorary contract to Public Health Scotland. He was supposed to be here for a year. I think it was a year, or at least a year, on a part-time basis, but he accepted a new post elsewhere. So I think we really got him for 6 months, but he had a lot of teething problems trying to implement his Python code using we just recently changed our infrastructure, moving to a sort of cloud-based thing called POSIT. So there was a few technical challenges. There's not a lot of expertise certainly within our area of PHS of using Python either. So it was a bit challenging, but he did manage to successfully run just before he left us, and we used some of his results in the final product. This one's a bit more high profile, from Gil Harper and colleagues, David Staples and colleagues from Endeavour Health. They've got a product called Assign. This was well reported, this study, and they again worked with general practice data, obviously not KI data, but very similar data from North East London, very high match rates, very high precision. So we had an agreement with them. We sent probably about half the addresses. So basically the ones which were not marked as excellent by Data Hub, but the less sort of precise matches, or those addresses where we couldn't find a match at all. So we asked Assign to process on our behalf. And so this is the results after all that processing. You can see it's gone up from just under 80% to just under 90% at the start of the database, and it increases steadily to you get a consistent 95% match rate by the time we get to sort of 2015 onwards. So very pleased again with these results. Probably there's not a lot of scope for improving too much on that. There's within the KI database, you do find a lot of people that are visitors. who've had some interaction with the health service, they end up getting a KI number, and their address will be either rest of UK or quite often overseas. So there's probably we're not going to improve too much on these results, but for research purposes, I think that's probably pretty excellent. So this was the next steps as it was in September. We're trying to have a soft launch of the thing, but it didn't really happen. I haven't really advertised this too much, and we're still actually doing a bit further exploratory analysis. Hope to produce a technical report which describes a bit more about the quality, about the biases and limitations of the data. For example, we know that there are a lot of recording of addresses where the address has been recorded as the actual general practice rather than a home address. So it's just trying to explain all this so that it's a useful resource for researchers. So a technical report, it was supposed to have, well, we're aiming for January. It's likely to be probably to be, I would say now, before that will be ready. For future tasks, these are things I've probably just plucked out the air. So it'll be reliant on our funders, I suppose, to if they want us to investigate some of these things, such as adding different types of residential institutions. We might want to look at schools or military bases. There might be some sort of governance issues around doing that type of thing. So that would have to be discussed. Exploiting the new KI database, I don't think I mentioned, I was supposed to mention that we actually moved, it was a complete overhaul of the KI database about just over a year ago. And it does now have the capability of collecting the UPRN at source. And we actually provided a number of the UPRNs from our initial matching in order to sort of prime feed that new KI database. We haven't yet seen the UPRN information on our PHS feed. That will be further down the line once we've had a change request put through, but hopefully that means we don't need to do this matching anymore, and we can just pick up the UPRN at source from the KI database. And then finally, just trying to come up with a technical solution, not specifically around Carole, but for geospatial projects specifically within the National Safe Haven. How do we store that data? Some of it might be quite huge if you're thinking about especially sort of environmental data and meteorological data, for example. It could be quite huge. And how do we, make sure that it's still secure? Because we're talking about having UPRNs which are hashed values rather than so that people won't actually see the UPRNs themselves. So a lot of questions around that and a lot of thinking going on at the moment. And then finally, just to say, well, thank you for listening, and thanks to the people named on this slide for their help in the development of the Carole product. And I think that is where I'll stop sharing.
Yeah, that's up there. Thank you so much, Dave, for that insightful presentation. It's really great to see all the impact that Carle's having in Scotland. I'm sure there's going to be quite a few questions, so if you have any, please feel free to either drop them in the chat or raise your hand, and we'll get to as many as we can. The GroundsWell team did pre-prepare some, but I think you've mainly covered most of them in your excellent presentation there, Dave, but I'm going to hand over to Sarah to ask one that we still have.
Yeah, just to echo what Elly said, thank you so much for that, a really comprehensive presentation. It's really interesting to see the development over the years and where you are now, and the sort of, I suppose you're on the cusp of launching everything, and other bits and pieces like the UPRN at source is catching up to improve things further, which is great. And it's really good to see the the addition of the assign algorithm in there and the use of the two different ones. I think that's really interesting. I was just wondering what, thinking back to when you were presenting this in Chicago, I was wondering what the reception was there, because I know some of my colleagues in Wales from when I developed the residential anonymised linking fields in Wales would have been there, and I was just wondering what they made of it.
I don't think I actually spoke to anybody from Wales about it, and the actual, when I presented it, there wasn't a lot of questions. I don't, maybe because it was late in the day on the Wednesday. I can't remember. So certainly I saw some of the presentations from Wales, and there was talk about the Ralph, and there was other stuff related to work that Endeavour had been doing as well, Ukrainians, which were all very interested to see how, from my point of view, how it was used elsewhere in the UK. But yeah, I think it's, yeah, I think there's certainly the Welsh thing that you talked about with the Ralph, that had been on our horizon for a number of years before we came to this. The researchers were always asking us, well, Wales are doing this, why can't you do this in Scotland?
I remember talking to Chris Dibben about it back in about 2008, I think. It was
we were always saying that sounds too difficult. I mean, we were good at doing the person level linkages, but there was a lot of addresses on Kai. How are we going to do this? And we didn't really know where to start, but it was basically the COVID thing that gave us the impetus to go and do that.
And that's interesting in itself, that it was the pandemic that was the main driver. Yeah. Okay, thanks. Hand you over to Wally.
Yeah, really interesting talk. I've got probably 10 questions written down here, so I will pick a couple and let some other people have a go. So you've got sort of thresholds that you mentioned in there, so excellent, good, fair. Where are you cutting off the sort of boundaries for those? What is an excellent match?
There is some documentation provided by Improvement Services that details how they. I don't really know. Obviously, I can't see the nuts and bolts of how they do that, but there is some technical documentation, which I couldn't actually tell you right now what those are. But I mean, excellent tends to be. I mean, there might be an abbreviation or something that's about the only difference, but I'm just going by when I've been clerically reviewing stuff, what I've seen. The fair ones, yeah, there's certainly a bit more uncertainty in those ones, and that's why we're seeing that 13% false positive rate. In terms of what we're doing to set the threshold, that was part of why we did the quality assurance, to see, well, can we accept those fair ones even though there's that 30% false positives? My view is that, that 30% false positives is a good trade-off to get that extra, I think I said between 5 and 10% matches. And that should be adequate for most research purposes. We're not talking about doing it for administrative data level linkage,
So sort of related to that then, so you sort of showed a breakdown by, I think, sort of whether it was rural or urban and others. And I think you mentioned deprivation in there, but I don't think you showed stats for it. Was there much of a difference between?
There wasn't any real pattern as such. So yeah, I mean, there was differences certainly between the decals, but it wasn't obvious that it was, I think if you looked at the category 1 against category 10, they were probably quite similar, and then it might be in the middle where there's differences. I can't really remember. I think it's more, certainly urban rural was more of a, there's clear patterns there compared to the actual deprivation, but obviously there'd be some sort of association between more deprived areas and cities and things like that, the built up areas.
Okay, all right. I'll let somebody else ask some questions.
Okay, we'll go to Claire next then, please.
Hi, yeah, thanks so much. Really enjoyed your presentation. Yeah, I did some of the sort of mock address matching with Hwayu at the time. It was really, really interesting because there's so many different ways that, as you say, that thing where you could interpret an address in different ways. So it's wonderful to see that it's kind of come to fruition. So I'm a GP and I'm really, really interested in who lives together in households, because my kind of clinical hypothesis is for older adults, it's super important in terms of our clinical decision making. You know, if somebody's unwell, who they live with has a massive impact on whether I refer them to hospital as an emergency or hospital home, or if they could just stay at home with antibiotics, etc. And for kids, so families with children, I think that it has a very, it's likely to have a really important role in how children develop, whether there's kind of a transgenerational transmission of general health disadvantage, etc. So that's what I'd really like to study, and ideally using Scottish data, which I've been speaking to Sarah about, which has been fantastic. So what I'm wondering at is about the granularity in terms of flats, because I'm aware that that was previously an issue, and because I think that where there might be more disadvantaged people maybe do live in flats more often, and that's why it's particularly kind of key. And in my previous work, I've been using census linkage to kind of allow us to identify, but it would be fantastic to be able to do this using routinely collected data, because then you have much more flexibility in your study design. So you may have totally answered this already, and I apologize if that's the case, but where are we at with the kind of granularity with flats? And do you think that there's enough certainty to be able to, because obviously with this study design, it's really important that we know that X person lives with Y person, if you know what I mean. Sorry, long spiel there, but I'm really interested in what you think. Thanks.
Yeah, I suppose so. It's a question of, you know, how well, you know, the flats themselves have matched. That's something we could look at. And we're actually doing a bit of that. That might be the analysts are working on their technical report at the moment. And so from the address space, you can pick up that sort of information about what is the type of property. Is it a self-contained flat or something like that? So that might be something we can look at and just try and tease out a bit more about the quality of the matches. But yeah, in terms of match rates, it's difficult to do because you don't know the denominator as such, or very easily.
So one thing that we thought about that could be possibly used to enrich this, and I think this is what they've done in CPRD, is using the mother-baby link. So you look at the records for the adult who's given birth, and then you look at the baby's birthing details. The problem is there's so many assumptions in that, which I really don't like. And what I like about the census is it's literally just who are the people in the household, which I think is actually more useful in a way. So if you could just use the UPRN linkage and figure out who's where, when, I think that's better. But I just wondered if there's any way that you could kind of enrich it to add to that probabilistic linkage. So if you know what I mean, no.
I'm not sure. I mean, it is what it is. We've got a 95% match rate if you're looking at the most recent point in time. And yeah, you can certainly identify people living in that address at that point in time. But whether there's something to tease out about the different types of property, I'm not so sure.
So it's not the type of property that's the problem. It's just that my understanding, and I might be wrong, and I hope I'm wrong, but that the certainty of that matching of those individuals was lower if it's a flat, just because there's like one F1. Is that still probably true to some extent, or
I think to some extent? I mean, the best we do at the moment is the urban rural category, is the match category 1. urban-rural category, and the proportion that we've matched and the precision of those matches. So I mean, we'll try and tease that out in the report, but yeah, I don't know how much I can say about the quality of those matches.
Okay, thanks so much. Really appreciate that.
So Claire, it might be worth a further conversation, maybe kind of breaking it down to look at a specific group and having a look at what other data sources are available that might help us maybe not necessarily improve the match rate, but understand the quality a bit more. So I think that could be worth a further conversation, because that sounds like a nice little research project going forward.
Exactly. And if you're just looking at households where there's a resident who's under 18, it helps to constrain it to some extent. And I've got a pretty clear research question. So I think, because obviously the permission, if you're trying to seed anything with any kind of census data, you need to have a very clear reason to do it. So hopefully that would make it more accessible. But yeah, that would be fantastic. I'd be really grateful for your time with that. Thanks.
Great, thanks. And I think, Tom, you had your hand up next.
Yeah, so I've got a bit like Ollie, I've got a few questions. I'm not necessarily going to ask them all, but I guess the first question I had was one of the slides you had towards the end where you're showing the match rates over time. And it just showed that the effect, or well, this was my question. It was when you use the assign and the flap, was that to improve the match rates based on what you'd done originally? So
yeah.
So that graph was basically showing that with just using the chi, or sorry, just using your first approach, it gives you a certain match rate, and then as you using assign and flap improved that. Is that what that graph was showing?
That's precisely, yeah. So basically, we've done it sort of hierarchical. We've just kept the data hub original matches, because we didn't give Endeavour all the addresses anyway. So the assign matches are additional matches, and then after assign, we've looked at any additional flap ones.
Right. Okay. Thanks. That's really helpful. Yeah. And then another question I had was just the matching itself. I think Ollie was touching on this. You may not be able to answer this because it sounds like it was part of the improvement service approach, but I presume it's just a string match where you're comparing the two strings and just looking at the differences between them, and then the match score is presumably summarizing that information. Is that right? So
yeah. As far as I know, it's the data hub matching is a sort of is basically does it on a probabilistic score type thing.
Okay.
And, certainly the flap does that. I've seen the results of flap. They produce a score, and we actually cut off because Hawaii's product you can cut it off at 0.5. I think we set it a bit higher because just based on the sort of what we were looking at, we set it maybe at 0.7 as a cut off there.
Yeah. So presumably, and that information, the match quality will be released to researchers, and so they can make a decision.
It's available. Yeah, we'll make that available. That's certainly. Yeah. And we can either make the decision prior to using the data for when we're assembling the data, or we can keep that in with the results.
Yeah, and do you recommend what match rate to go with? Is that something you're going to do, or is that something just purely left to researchers? Like, could you recommend not going below, say, good for matching, or is it just purely left to the researchers?
If you're needing precision, then I wouldn't go below good. Yeah, but if as I said, if you want more matches at the expense of a bit less precision, slightly less precision, then you could include them.
And can I be cheeky and ask one last question? Is that okay? So this is a bit more of a general question. It's just about, you mentioned at the end about the issues around geospatial linkages. As someone who's done quite a lot of this and probably irritated Idris extensively with my requests for air pollution data and whatever over the years. I just wondered where we're at, what's the thinking around that? Is there a kind of an approach you're taking? And the reason I'm asking this question is obviously because for me, I'm particularly interested in air quality exposure a lot of the time, and often that can vary over quite small distances. With the UPRN, that gives you pretty much an XY coordinate, essentially, or you can certainly get that from the UPRN. And from that, we can actually, using air pollution modeling, we can actually estimate air quality at that XY coordinate. Now, everything we've done up to this point has been postcode, and that's been onerous and arduous enough. But adding UPRN to the mix, it's going to make the dimensions of those data sets potentially even bigger. So I'm not expecting you to be able to answer this question, but I guess I was just wondering what the current thinking and direction that you're thinking of going with these kinds of linkages. Have you kind of alighted on a particular approach, or is it still very early days and figuring out how to deal with some of these issues?
I think it's early days, but I mean, there have been there's a lot of thinking going on recently, and I think, I mean, obviously, as you said, these are really huge data sets. I think when you get to that level, so it's up really to EPCC to come up with a storage solution, and and how the cohort interacts with that data, and also keeping it nice and secure. It's probably beyond my technical knowledge, but
yeah, but it's the conversation. So what a little bit frustratingly, there's a project going on, Scottish Government and ADR, that hasn't got to where I thought it would, because we're trying to understand, well, what are the requirements in order to be able to provide a geospatial platform. So just as Dave's kind of talked about, what are the kind of geospatial linkages? What are the kind of, the implications for storage, for compute power, etc., to understand that. But so I know from the ADR side, they've been getting a little bit frustrated as well. So hopefully we're trying to address that so that we can actually push some of that work forward, because it would be good.
Yeah. Okay. And I guess to add as well, I guess when we're putting an application together for data lock that is going to hopefully use UPRN. So presumably there's a lot of what you're doing here will be available to data lock as a regional service. Is that an option too? In other words, would data lock have access to the geospatial platform? Because I think they're all working within the same national safe haven.
So they've got separate, yeah. So, well, yeah, in the future, yes. Whenever we've got that set up, yes.
Okay.
Yes. I was thinking of now, but we don't have something now. So, but in the future, yes.
Okay, great. Okay, I've abused my privileges, so I'm going to hand back to Elly. Thank you very much. That was really helpful.
Okay, yeah, I think we've got time for our final 3 questions. So I'll hop straight over to Sarah.
So I think my question kind of relates to a bit of what Tom was asking about not just the fine scale resolution, but the actual longitudinal part. So thinking about maybe other geospatial data, like access to green spaces, for example, and is there a way with the curl that you can look to see where people are moving house and update their exposure to other environmental metrics over say a decade of time, so that we could look at that?
It should be possible, yeah. So we've got, as I said, we've constructed the address history file based on information that we recorded on CAI about when patients have transferred off out of an area. We used the actual download dates from the CAI to help with determine what the start and the end date is of overlapping episodes, I suppose. So we've constructed it with a start date, end date. There's some gaps where we think people have transferred off CAI, they've moved elsewhere out with Scotland, and they might have come back again. But yeah, so we can pinpoint where they are at a particular point in time, what the UPRN is, so we should be able to link that to data associated geospatial information elsewhere.
Yeah, that's really useful. And going back to what you said earlier about potentially putting schools in there, I did do a project that was about air pollution and linking children from their home exposure to their school exposure and thinking about their potential journey as well. So there's a variety of things that you've opened up by building these curls. So yeah, thank you. And I'll hand over to Anna.
Yeah, thanks so much. I had another question, I guess, about the data, the quality of the match rate. And I was wondering if you had a sense of, like, those things like the fair matches, where are the differences in the matching? So is it like predominantly, say, at postcode level? Like the postcodes are different, which you maybe might expect because some postcodes change over time, or like, yeah, do you have a sense of where in the address they're not being matched?
Yeah. Yeah, so those that are coming up as fair, I think you're absolutely probably hit the nail on the head. It often tends to be just a typo in the postcode, which, I mean, often they use the postcode as a sort of major blocking variable. Yeah, it's often that, or there's maybe another bit of information in the address on the Kai side that's missing, which makes it slightly more ambiguous, I suppose, for the matching. I don't have any sort of, I can't think of any sort of specific examples right now, but that was just from the some of the reviewed work that I've done.
Thank you.
Okay, Elly?
Yeah, so I was going to ask about statistical disclosure control, everyone's favourite topic. So when, once you've got all the UPRNs, obviously if people are going to use it, they're going to be hashed. So that sort of gives one level of privacy. But there's situations just with the hashed UPRNs, think, I don't know, a boarding school or something, where you'd see lots of kids living at the same UPRN. So looking at the data, you'd be able to figure out that those are children living at a boarding school, which is then additional information. Or you could do the same with a prison or something like that, I would expect. So from that perspective, but then also from the linkage of external data as well, there are tons of edge cases when we start linking data, and you get the distance to hospitals and stuff. If you've got some guy living out in a lighthouse 100 miles away from the nearest hospital, he's probably the only person in the area that does that. Or, I mean, we've been trying to figure out how we're going to link some of our green space data, and even just tree canopy coverage there are edge cases that come out where there are unique people in the data. So I guess my question is, what are you planning on doing for your statistical disclosure control?
So are you talking about, the disclosure risk when you've got the assembled data, or are you talking about the final outputs, which release from the safe havens? Because different.
Probably less the output, because
Yeah.
that's easy enough to aggregate up to sensible numbers, isn't it? But once you're, in your trusted research environment or whatever, there's going to be mechanisms where people can reverse engineer to get back to a UPRN.
It's good questions, and yeah, you're right. As with any joining additional data sets, you're going to increase the risk, but that's what the 5 safes, I suppose, are. And that's kind of why we've got the safe haven and the safe research and training and so forth, is trying to mitigate these risks and, trust the researchers. But as long as the output at the end is secure and not too disclosive, then yeah.
Yeah, it's the same risk as giving them access to individual patient level data that tells people, somebody's clinical history, essentially, in the environment. So it's all the mitigations around it, as said, the 5 safes and the user agreement and the sanctions. I mean, I've banned one researcher in the whole 10 years we've been running this. I've just recently banned my first ever researcher from doing bad. So you've got to always have a level of trust, and that's why we have all the security features and the user agreements, etc., in place. So
that's sensible to me. Thanks, Carole.
Okay, so it might be time for one quick last question. If anyone has anything burning? No, we're okay. Okay, well, thanks all you for joining today and for the great questions. If you've got any follow-up questions or like to learn more, I suppose it'd be all right for them to send an email. Maybe we'll do a joint email together if that's all right, Dave and Carole.
Yeah, fine.
Okay, great. Well, with that, I'll wrap up today's session. And thanks again to Dave and Carole, and thanks everyone for being part of the webinar. Have a great day.
Thank you.
Thanks
Thanks
very much, everyone.
Thank you.
See you later.